Turning 65 doesn't always mean retiring. For many, it means continuing to work or staying covered under a spouse's employer plan. But Medicare rules don't pause just because you're still on the job. The timing of enrollment, the size of your employer, and how your coverage coordinates with Medicare all matter. Get it wrong, and you could face lifelong penalties or expensive gaps. Get it right, and you can keep costs low while enjoying the benefits you've earned. Think of Medicare enrollment like setting an alarm clock. If your employer has 20 or more employees and you're actively working, that alarm may not ring at 65. You can safely delay Part B as long as your coverage is considered creditable. But if your employer is smaller, Medicare becomes your primary coverage at 65. In that case, you must enroll to avoid unpaid claims and penalties. And remember, COBRA, retiree benefits, or a spouse's retiree coverage do not protect you from penalties. When you're working past 65, one plan pays first and the other pays second. The rule is simple. If your employer has 20 or more employees, your job's insurance pays first and Medicare is secondary. If your employer has fewer than 20 employees, Medicare pays first and you must have Part B. Many seniors regret not knowing this sooner. Some pay for overlapping coverage, while others face denied claims because they didn't enroll in time. Think of the special enrollment period as a flashlight guiding your way once your job coverage ends. You have exactly 8 months to sign up for Medicare Part B without penalty. Miss that window, and you'll wait until the next general enrollment period, with premiums permanently higher. To use your SEP, you'll need documents from your employer showing you had continuous creditable coverage. Planning ahead means no stress and no surprises. Delaying Medicare Part B can save you money. If your employer plan is affordable and provides good coverage, delaying Part B makes sense. But if your plan has high deductibles, costly copays, or limited networks, Medicare may be the better choice. And unlike many employer plans, Medicare works nationwide, a big advantage for retirees who travel. Health savings accounts are like a measuring tape. Once you enroll in Medicare, you can't stretch them any further with new contributions. Part A can even be retroactive by up to 6 months, creating tax headaches if you don't stop contributions in time. The good news is, you can still use your HSA funds tax-free for qualified medical expenses. Just remember, Medicare isn't entirely free. Part B premiums and cost sharing still apply. Employer size is one of the most important Medicare rules. With fewer than 20 employees, Medicare automatically becomes your primary insurance at 65. That means you must enroll in Part B to avoid denied claims. With larger employers, your job coverage remains primary, and you may choose to delay. The same rules apply if you're covered under a spouse's plan. Prescription coverage is like a puzzle. The pieces must fit together. Your employer will tell you if your plan is considered creditable, meaning as good as Medicare Part D. Keep that notice, because without it, delaying Part D can mean penalties. Formularies and copays vary, so compare your job's plan with Medicare each year to avoid surprises. Medicare penalties are lifelong. For Part B, the penalty is 10% for every 12 months you could have had coverage but didn't. For Part D, it's 1% for every month without creditable drug coverage. To protect yourself, keep HR letters proving your coverage. And remember, COBRA does not count as active employer insurance. Comparing your employer benefits to Medicare is like relying on a guardrail on a mountain road. It keeps you from costly mistakes. List out your premiums, deductibles, doctor networks, and prescription benefits. Medicare, Advantage, and Medigap plans each work differently. And while employer networks can be narrow, Original Medicare is accepted nationwide. 90 days before your 65th birthday, check with your HR department for coverage letters and employer size. 60 days before, review your Medicare options with a licensed agent. If you travel often, consider Original Medicare with a Medigap plan, since Advantage plans may limit you to certain regions. Planning ahead ensures a smooth transition. Still working at 65? Don't let Medicare penalties or gaps catch you by surprise. At Palmetto Mutual, we'll help you keep the benefits you like from work, fill in the gaps where Medicare is stronger, and avoid paying for coverage you don't need yet. One simple review today could save you years of higher costs tomorrow. Call now or schedule a free consultation.